Okay, welcome everybody. For those of you that don't know me, my name's Pegs Bailey. I'm the National Third Sector Employability Partnership Engagement Manager in Scotland, and I'm really delighted to welcome you all to this Commissioning with Communities webinar today. The webinar is brought to you with support from Social Enterprise Scotland, who are providing fantastic tech support and also recording the session. So that recording will be available to you afterwards, and to anybody else you think might be interested. The National Third Sector Employability Forum and also the TSI Third Sector Interface Network have all been involved in helping bring this together. We're delighted to welcome Amy Hurst and Helen Sharp, who are going to talk to us about commissioning with communities. But before we do that, just first of all, an invitation to be muted if you haven't. We might mute you because we're quite a big group. And I guess a kind of why are we here? Why are we having this session? So, I mean, as many of you will know, engagement, involving communities in the services that are there to help them and support them, that's been a kind of founding principle for Scottish Government for quite a long time now, pretty much ever since the Christie Commission. It runs through a whole range of different policy initiatives, funding drives, and is really important in the landscape of employability under the kind of band of service design. Let's plan and develop and deliver and think about what we're doing with our employability funding, and do that with the broadest range of perspectives possible, including, crucially, the people that we're there trying to support. Inevitably, as any of you who've tried to get involved in this kind of work will know, that is something which is much easier said than done. There are challenges around engaging with our procurement and planning partners within our local authorities. There are challenges around encouraging people to get involved and feel like their voice is actually going to be heard. Challenges with our senior leadership, and challenges making sure that actually meaningful changes do happen as a result of that participation and engagement, and it doesn't just become a tick box exercise. So I'm really excited to have Amy and Helen here to talk about their experience, their knowledge around commissioning with communities, and what that entails, some of the challenges, and some of the real successes and things that can really help that, why it matters. There's going to be some time at the end for questions, but I think there's also going to be other bits and pieces to help everybody engage. So I think that's it from me. I'm going to mute and hand over to Helen and Amy.
Thanks very much, Pegs, and thank you so much for having us. My name's Helen Sharp. I work for an organisation called the Ideas Alliance, and we have a range of different associates in the UK going around basically helping people to be brave, particularly around co-production, around collaboration, all that sort of strength-based. Pegs, are you?
I'm just not hearing you very well, Helen, and I'm wondering if that's me or if others are experiencing challenges. I'm getting
it's a little quiet.
Yeah,
you're a little quiet, Helen.
Okay, if I come even closer, then I have a huge head. I'm happy to shout. Is shouting better?
It might get a bit tiring for you, but yes, that does help. Thank you. Sorry.
Okay. No problem. So we basically work around the country, working alongside people, helping them to be brave, helping them to really understand how to bring the voice of the people they support into everything that they do, from co-design through to delivery. So yeah, that's my background. Amy?
Morning, everyone. Really nice to meet you. My name's Amy Hurst. I work for an organisation called Collaborate. You won't be surprised that part of our work is to help people to collaborate. So we work again across the country to bring people together around places, around systems, and are really interested in approaches to system change, but also how we can develop approaches to system change which really put people and communities right at the heart of that. So how we can bring public services together alongside people and communities.
Brilliant. Thanks, Amy. There's so many of you, we're not unfortunately going to be able to do introductions with everybody, but what we would like you to do, so one of the things when you're thinking about insight gathering and bringing people together is one of the main focuses is to level out the playing field, is to level out the power that we hold compared to them. And so what we would always suggest is if you've got a room full of people, do not use your job titles. What we try to use instead is our fantasy job titles. So what we'd like you to do is, in your own time, in the chat, is to write down your name and your fantasy job title. What would you really like to be doing? So we'll have a little look at that as we go. The other thing to let you know about is that, as Peg said, we will be having questions at the end of the session. There will be a point, we're going to be showing a film at the beginning of the session, and there will be a point where we'll ask you to put some more comments in the chat, but otherwise, if you can save your questions to the end. But I'm going to hand over to Amy to also describe a piece of software we're going to use where you can also write questions in. Amy?
Yeah, so I've put a QR code up on the screen, and I think Helen's going to drop a link into the chat for you. We're going to use Menti to gather your questions. So all you need to do, if you click on the link or if you go via your QR code on your phone, you'll have the opportunity to submit questions as we go along. That just makes it a little bit easier for us rather than trying to keep track of the chat. We really welcome you putting your reflections and ideas in the chat as we go. We'll come back to this at the end. I'll do some quick synthesis of the questions, pull themes together, and we'll try and pick up as many as we can. So hopefully you can all access that. Any problems, drop a message in the chat. And if we can't get it working, we'll pick up questions in the chat as we go. But hopefully Menti should work for us as we go along.
Thanks, Amy. Apparently the QR code hasn't shown up. Can you, it hasn't shown up on the screen.
Yeah, it's showing, it's just showing the share thing. So I think.
Oh, okay. Let's stop. Let's try and share again. Bear with me. Can you see? Yeah, perfect. Go. Okay. Thanks, Helen.
Okay. So, insight gathering. Why are we doing it? Well, one of the key things that we think is missing in a lot of the services that we design and we deliver is that they are quite often misaligned with what matters to the people. The sort of historically, I would say that the majority of public sector services have been designed in an office. I am somebody who has done that myself. I used to be a commissioner at Lambeth Council, and when I first started at Lambeth Council, I was a youth and play commissioner. And it was just before austerity hit, and I was given a spreadsheet of what to do as a commissioner, and there was nothing on that spreadsheet that told me to go and talk to a young person. So we sat in our offices, and I wasn't young and I didn't live in Lambeth, and we created what we thought was a fantastic activity programme for young people in Lambeth. After austerity hit and we started to co-produce much more, that was when we were able to go out. And it wasn't that we got it wrong, but there are golden nuggets, and there are ways in which the people that we are supporting, they see the world the way that which is different to the way the system sees the world. So at the moment, in so many sectors, it is the system that is deciding what matters to the people, and that's what needs to be realigned, is that purpose. So gathering insight is your first sort of step into that world and into doing that. And so we're going to spend the next hour and a half talking to you about some of the ways in which you can do that, thinking about what it is that you really need to take into consideration, and just a few sort of tips of the trade, I suppose. We're going to start with a film, though, which really sort of explains why it is that we need to be working alongside people in a much more in-depth way. And this film is called The Parable of the Blobs and Squares. Some of you may have seen it before, but in terms of explaining co-production, explaining why we're trying to change things, this to us is the best film that we have. So Amy, over to you. We don't have any sound.
Okay. That's annoying because it was working just now.
Bear with me. Let's try this again. We don't need that.
Like to do stuff. They think they can help and make people better. They're also answerable to the people, and they don't want to be seen to waste their money. And they take this responsibility very seriously. So seriously, in fact, that they count stuff and measure stuff and arrange stuff so they can tell people where their money has been spent. It's really not that easy. And so they have to order the stuff in certain ways. But some things can't be counted, measured, and arranged. Let's call these things the problems. Sometimes the problems don't look like squares. Sometimes the problems involve people. And when problems and people come together, they aren't squarish. They are, well, blobbish. Blobs change and don't like being stacked and arranged and organized. Why, government wondered, did every time they try to solve a problem, did the problem get worse? Why don't these problems know what's good for them and stay put so that we can fix them? The government said, this isn't working. We don't seem to be able to get to the bottom of this. Who can we get to help us understand the problems better? But because the government is so responsible for how they spend people's money, they needed to find people they were sure they could trust to spend it wisely. They asked some people like them, who looked like them and talked like them, and they gave the money to them because they trusted them to manage it, account for it, and spend it in a sensible way. And of course, they looked, well, a bit squarish. This is a big job, said the little squares. We must do our best to succeed. And so they set about developing the tools to do the job, the equipment, the institutional capacity, professional expertise. And they set about understanding the blobs better, because how could they help if they didn't understand the problem? They invested in the process for solving problems, and they invested in the infrastructure for solving problems. But no matter how much the squares tried to reach out into the community and understand the root causes of the problems, they never managed it. They really weren't able to get to where the problems were. They were, well, just too squarish. Oh dear, the government squares said to the little squares, this isn't working. And it wasn't. A gulf still separated the squares from the blobs. It wasn't working because however well they understood the problems simply weren't theirs. And no matter how hard they tried, the problems just wouldn't stand still. We've invested all this money, said the government, created all this expertise, built all this resource, but it still hasn't worked. And so they tried to bridge the gulf by asking the little squares to find blobs they could partner with. And so the little squares invited the blobs that seemed like they had the energy, vitality, and the drive to make a difference to work with them and sit on their boards as representatives. This time, they didn't just experiment on the blobs. They asked the blobs what they wanted and what they thought and how life should be. But this approach made the blob unhappy because it seemed to reinforce the difference even more. Oh dear, the squares said, this still isn't working. So they tried giving some of the money directly to grassroots organizations that were very blobby. They must be able to solve the problem, they thought, because you can't get closer to the problem than that. But to be trusted with the money, the blobs had to produce reports, attend training sessions, and write risk assessments. And by the time the blobs had done all this, something strange happened. They had ceased to be blobs and had become little squares. And by the blobs becoming squarish, they lost everything that made them blobs. Their energy, grassroots connections, vitality. And something more important happened. They became neither blobs nor squares. They lost their sense of what made them who they are. And they lost their sense that they could do something to help, that they could solve problems, and that they had an idea of how to make the world a better place. We think it's a different way. We think the squares are really good at some things, and we think the blobs are really good at others. We think co-production is a different way for squares and blobs to work together. While the squares may well be the experts in the process, the blobs have something equally important and something the solution needs: the context. Co-production is a partnership where the process and context have equal value, where squares and blobs need and value each other for who they are and what they can give. One is not more important or valuable than the other. It isn't about imposing a solution on the problem. Instead, it is about understanding that the solution can only lie in the problem. It is only through a process where the assets of both the squares and blobs are valued equally that great things can happen. Each one of us has a strength. As a professional is more than their job title, a person is more than their problem. Co-production matters! To find out more about co-production and a new way to do business, go to www.
Thanks, Amy. What we'd like you to do actually is just while after you've watched that, what we find is that certain aspects of that film resonate particularly with people. So if you'd like to write in the chat, just elements of that film that you really recognise. Interestingly, I was working with a housing association yesterday, and a couple of them had been that service user that was sat in the board meetings, and just how much they felt they had to shout to be heard, and then that the board members just saw them as being really radical and really annoying because they wouldn't shut up. So it's that awful sort of juxtaposition. So that sort of hopefully sets the scene of why we're here and what we're trying to do. I'm going to hand over to Amy, who's going to take us through the systemic approach.
So to put this in a kind of, I guess, a wider context, so we've dug in a little bit about why working alongside communities matters, but where does this fit from a systemic point of view? So for us, this work is part of our broader approach to how we're working alongside commissioners across the country. So Helen and I, along with some colleagues from the Co-Production Collective, we run training for commissioners, and the kind of session we're running for you today is part of it. Now, part of what we're trying to do through that training offer and through the support and work we do alongside commissioners is to really reimagine what commissioning is. So for us, the purpose of delivering public services, and public services are there, they are really there to enable human flourishing. Now, some of you might have heard of something called human learning systems. I could do a whole session on human learning systems, which I'm not going to do, but we'll make sure we share some links afterwards if you want to dig into some of those ideas, because a lot of this comes from there. So when we talk about human learning systems, what we're really thinking about is really acknowledging the complexity that we're all working within. So people's lives are really complicated, and services can't really be responsible for delivering single outcomes. When you think about people's lives, there's a whole range of different things which impact upon that. Some of that is to do with the services we provide. Some of it is to do with much wider systemic issues. So when we're thinking about reframing commissioning, what we're really trying to encourage people to do is acknowledge that complexity, to lean into it and not try and control it, but to really kind of think about how we can work in that complexity and what that might allow us to do differently. So when we think about commissioning, what that means and what that allows us to do is to rethink it. So to rethink commissioning away from the kind of traditional view, which is, around purchasing outcomes, and start to think about what's possible for commissioners in terms of how they might start to nurture healthy systems. So what you've got here on this slide is a human learning systems learning cycle. But it also serves as a reimagining of a traditional commissioning cycle. So in a traditional commissioning cycle, you have the kind of the four component parts. So you have the analyze, plan, do, review. Those features are all present on this cycle, but they work in different parallel processes, if you like. So at the start of learning about the system, we have this cycle at the top, which is really about understanding the system. That's where we're focusing our attention today. So we're thinking about how we can use insight gathering, how we can work alongside different people in the system, whether that's people who are accessing services, whether it's other professionals, whether it's people in communities more broadly, to really dig in, hear their perspectives and bring all of those things together. So in doing that, in that understanding the system, what our aim is, we are looking to really build relationships and trust with people across the system so that we can understand what our shared purpose is. What is it we're collectively trying to work towards, and how can we start to surface that? So that's where we're focusing today. When we think about a traditional commissioning cycle, so that analyze, plan, do, review, very often insight gathering only really happens at the analyze stage. It only really happens at the start of that cycle. One of the things we want to encourage people to think about is how you can use insight gathering the whole way around. So once you understand your system, how can you co-design services with people? And how can you create cycles of experimentation, those bits that you've got at the bottom? In order to work in an experimental way and kind of put those little mini pilots, those little tests, those little experiments into practice, you need to be constantly gathering insights from people. So what's working well? What's working less well? How might we do things differently? And how can we pull those insights together and share them generously across the system as a whole? So not holding on to them tightly as commissioners with a responsibility for a very kind of maybe narrow slice of the system, but how can we start to open that system up and work much more collaboratively? So in terms of how we might take a systems perspective, what you've got here is a presentation of a system from Brothenbenner and the ecological systems theory. Now, what this is trying to show is that there are so many different factors that have an impact on people's lives. So in this, you've got the individual right at the centre, and then as we move out, there are all sorts of different things which have an impact on people's lives. In understanding and gathering insight, we need to touch on all of these different layers. So there's something about understanding what's happening in the immediate environment for people, what's going on in terms of their workplace, their peers, their family relationships, their immediate contacts in the local community. As we move out, we get kind of technically further and further away from people, things like the media, things like local and national policy, culture, laws and kind of dominant ideologies in the system. But all of these things matter. And what we're hoping to kind of demonstrate by sharing this with you is that gathering insights really makes a difference when you're thinking about how you design services and how you step into commissioning processes, because we can't control all of this. All of these different layers are outside of our control. This is part of the complexity of people's lives. So it's thinking about how we can draw on that and how we can understand it, but also how we might use that to rethink what it means when we put performance measures in place. So recognizing that services can't really be responsible for individual outcomes because there's so much complexity going on around there. So how can we work with services to understand the broad outcomes that they might contribute to rather than those that they might be actually accountable and held accountable for, because that's just not possible when you understand complexity. So to give you an example from our work of where we've done this elsewhere, appreciate this is an example from England and some of you might have some brilliant local examples. Do feel free to pop them in the chat. Last year, we worked with the East Sussex system around running a review of their welfare benefit and debt advice services. So quite a broad service which ran across the whole county. What we did in doing that review was working with everyone who had a role to play in that system. So we started with the people accessing services, but we also sought insights from providers across the system and from other kind of other local services who had an impact on that. So in the welfare benefit and debt advice space, that included people like Citizens Advice, but it also included people like GPs who might be making referrals or who might be picking up when people are starting to get into trouble around debt and starting to face challenges. We also spoke to families of people who were accessing services. We spoke to children, we spoke to schools, kind of recognising that all of these different people had a role to play in this particular system, so in the welfare benefit and debt advice service system. Now, what that's enabled colleagues in East Sussex to do is to build some really strong, trusted relationships with people across the board. People felt listened to, people felt heard, and they felt involved in the process from the start. So they've really deepened relationships across the board and are now stepping into a commissioning process on the back of that. So this is an example of where we've done this around the whole frame of commissioning. So this was before they even decided whether they were going to commission a service, but the relationships they built through the review, through involving people and through gathering their insights throughout, have started that process. And now people are involved through co-design. They're going to be involved in the procurement process, and there are also plans to involve people in the ongoing monitoring of review and services once they're in place. So Helen, I think I'm going to hand back to you now to talk about developing outcomes.
Brilliant. Thanks, Amy. So the insight gathering that we're trying to do is really, as I said at the beginning, to try and sort of align what we're doing with what matters to the people, not what matters to the system. And there's a range of different ways in which you can do that. And I think one of the important things is that you consider that range of different methods, that you don't just use one way of doing it. You know, things like surveys are great, but very often the questions that you put within a survey tend to give you the answers that you're looking for. And what we're going to be looking at this morning is really how you change your questions. And we're going to introduce you to a method called appreciative inquiry, which is a way of looking at the world within a much more positive light. So it's less about what's wrong with things, but much more about what's strong and what we can build on. We don't have any money anymore, so that whole sort of traditional way of doing a needs assessment and looking at where the gaps are and then plugging those gaps with services, it never really worked anyway, and now we can't afford to do it. So this is much more about really sort of appreciating and valuing the people that will come and help you gather that insight, and then carrying that through all the work that you do. What we mentioned before about the sort of the levelling of power, when you're going out and gathering insight, as much as possible, you want to see people as colleagues, not as a different type of person. The same housing association I was working with yesterday, there was it was really interesting because they were talking about the fact that quite a few of their staff had never actually been to the estates that they run, and the way they talked about their tenants or their customers, as they often called them, was almost like they were a completely different type of person. So there was no sense of understanding, and there was a lot of assumptions made about people and then decisions made upon those assumptions. So what you're trying to do is to get out there and understand people, but also the way to understand people is to go in as equals and not as the people with power. Next slide, please, Amy. There's an amazing GP surgery based up in Leeds called Robin Lane, and they were one of the first GP surgeries to take on health champions. And when the funding finally ran out, they had 300 health champions. Now, the GP surgery could have said, well, thanks very much, the project's over now, you can go. But in fact, what they did was to welcome them all in and say, okay, we don't have any money, but what should we do together? And Robin Lane GP surgery is now the only GP surgery in the UK with a licensed bar. It has a cafe. The reception is in the cafe. You go into the cafe and if you want to see a doctor, you can see a doctor. But if you want to join the ukulele lessons or the ballroom lessons or the book club or the choir, then all of those things are run by people who use the GP surgery. And their way of looking at the world is the more people that come into our GP surgery, the more we can do. So they don't have anything called demand management. They also have the same number of GP appointments, but they have 5,000 more people that have joined the surgery. There was an organisation that decided to evaluate what had been going on in the GP surgery, and they discovered something quite interesting. So, next one, please, Amy. The idea is that we have two different worlds. We have our home world, next one, Amy, and we have our work world. What we tend to do when we're at work and we think we need to gather insight is we invite people from their home world into our work world. Now, our work world is quite different from our home world. We tend to sort of, particularly when we used to go into work all the time, less so maybe now that we work from home, but we put on our lanyards, we put on our uniform, we use completely different language, we don't use a strategy to go shopping. We are less affectionate at work. We don't constantly tell the people that we work with how much we love them. But what we're trying to do is to bring people from that world into our work, train them up to understand what we're talking about, try to dumb down our language, try to create a space that we think will work for them. And then we don't understand why the usual suspects keep coming. And the usual suspects will come because they are confident enough to come into that world. However, what they discovered from the evaluation of Robin Lane is that there is a third space. Amy? The idea is that when you're considering gathering insight, you need to create a new space, a space where you all come together neutrally. That immediately levels out the power between you. You can facilitate that space, but you're not in charge of it. So the idea is you create a language together. You decide together how you're going to behave. And you understand together in that space, what should we do together? You need to think quite carefully about how you invite people. Make sure you take your lanyards off. Don't use job titles. So there's lots of little ways in which power can manifest that you will need to be careful of. But within that liminal space, you act as colleagues. You are a team. And people with lived experience, they will come into that space, not just because they have lived experience, but also because they have skills and abilities to share with you. And I think that's quite important, actually, is when you're working together with people, don't just see them as people with a story. See them as people in their own right, as having those skills and abilities, those resources that you don't have. And actually, that really builds up the ability to what you can do. So there's another way of looking at this. So Amy, next one. So your home is the land. The home world is the land. Amy, the work world is the sea. And in the liminal space, you meet together on the beach. It's the one place where you can act and behave differently. Thanks, Amy. Next one. So why are we gathering insight? Okay, well, we need to try and get the outcomes right. We need to try and understand what it is that we're trying to achieve. And what it is that we're trying to achieve really focuses down on what it is that the people that you're supporting are trying to achieve. So you need to start with them. The outcomes need to be their outcomes. They're not system outcomes. We need to understand what matters to people, not necessarily what people want or what they need. What tends to happen is we often go out and we gather information about what they want and what they need, and we come back with a lovely wish list, which we can no longer afford to do. And actually that means we're taking away from them their own autonomy and their own agency to be able to do stuff. So what you're trying to do now is to understand what they value. What is it that's already helping them manage? And then building on that. It's also quite important to understand the interaction that they have with other things outside of services. Understanding emotion. Emotion is a really key player in how people engage with the world. We very rarely talk about how it feels to be part of our processes and part of our referral systems. So bring emotion back into the conversation. But the other thing is that you don't know what people need until you know what they've already have. So it's understanding what else is out there, what is already helping people manage, gathering information about assets, about strengths, particularly locally. When I was a commissioner, we did a needs assessment, which constantly told us exactly where the deprived area of Lambeth was in London. It never changed. It was a long sort of river of deprivation through the centre of the borough. And we would look at what the gaps were, and then, as I said earlier, we'd plug those gaps with our services. We never once went into Lambeth to ask what was going well. What do people use? Where are all the amazing places? Where are the hidden treasures? Where do you go when you first need support for your child? You know, it's generally not services. It's all that sort of, what we would call the core economy, all the people, all the interactions, all the neighbourhood stuff that's already going on. So it's really important that we understand that as well. Next one, Amy. So we're going to ask you to do a little bit of work now. I hope that you've got a piece of paper and a pen handy. What we'd like you to do on your piece of paper and pen is we're going to find out what matters to you. It's really easy. So none of this insight gathering is difficult. It's not rocket science. It's really just sort of spending a bit of time thinking about the questions to ask. And the question that I'm going to ask you is I want you to draw something on your piece of paper that represents something that you value in your local area where you live. So something that you value in your local area where you live. It can be anything. So there's no rules about this. It can be absolutely anything. The first thing that comes to mind, if you can draw it. And you've got about 2 minutes, maybe longer. Pegs, it looks like yours isn't going so well. So I'm not going to ask you to share them. Oh no, that's pretty good. Normally we get you all to share them. There's too many of you, so feel pleased that we're not going to be checking out your drawing abilities. Amy, do you want to stop sharing for a bit? Okay. what I'd like you to do now is write in the chat what it is that you drew. And I'm going to see what comes up. Okay. Brilliant, keep it coming. I don't know how many of you are keeping an eye on the chat, but there's quite a lot of, there's a big theme coming up, which always comes up, which is outdoor space. So we've got hills, fields, we've got sea, we've got local parks, places where people walk their dogs. Yep, we've also got people. We've got a lot of stuff around connecting with people, community centres. We've got friends. Yep, cafes, coffee shops, community centres. We've also had a library that's come up. Yep, brilliant. Okay, so we do this exercise all the time, and the first time we used this exercise was when I was a Youth and Play Commissioner, and we did it with young people in Lambeth. And what was interesting about that is that some of the stuff that you've come up with, they also came up with. We were really surprised that they took notice of the environment, that they cared about the derelict buildings, and they noticed the trees, and they used the parks. So that came up an awful lot. But the other thing that came up, which was interesting, was bus stops. And interestingly, I've not noticed anybody put transport down. Maybe that's because your transport's not brilliant. When I was in London yesterday with the housing association, many people put bus stops and the TfL, so the underground and all that stuff. For them, that's a sense of autonomy. That sense of being able to do what they want to do when they want to do it, being able to get out and about, meet their friends. And for young people, it was about meeting their friends and getting away from home and being able to go somewhere where they wanted to be. So the other thing that came up quite often was also their level of being able to be employed, so sense of purpose. So we had young people who had set up their own businesses, we had young people who were volunteering, young people who wanted to do more of that sort of stuff. So that having that sense of purpose, having a reason to get up in the morning. Some of the stuff that you've already come up with, we can attribute to outcomes such as keeping active, all the sort of dog walking the hills, being out and about, having a sense of belonging, connectedness, so that's sort of the community centres, the pubs, the being with people. Another one is keeping learning, which particularly around the library, where you're sharing ideas, you're learning more about stuff. But one of the big ones that comes up all the time is environment. And I'm just wondering whether any of you have noticed, it's difficult to ask because I can only see about 10 people, but a lot of these relate to something called the 5 Ways to Wellbeing. And the 5 Ways to Wellbeing were created by the New Economics Foundation probably about 15 years ago now. And they are an evidence-based set of things that help improve your well-being. And the reason that there were 5 of them is because it fitted in with the 5 fruit and veg, and apparently we can only really remember 5. So there were many, many other things that went into the well-being research, and one of the ones that dropped off was in fact looking after the planet, which was a shame. So that's number 6, that's the 6th way to well-being. But the ways to well-being are keep learning, keep active, take notice, to give, and to connect. So I suppose what I'm trying to say is that when you go out there and you gather insight from people and you try and understand what it is that matters to them, it will be very similar to what matters to you, is it's all about well-being. It's literally all about well-being. But unfortunately, most of our services are not set up to help people's well-being. They're set up for all sorts of One of the reasons I think that we don't set up services to help with well-being is that we consider it to be quite difficult to measure. It isn't, but it's not easy to quantify. And we do like numbers, and we do like counting beans, and the people above us who fund us also like counting beans. So actually, to be able to quantify well-being, we need to be a bit more creative. But when you go out and you ask people what it is that they value, it will be well-being. There is some research to suggest that the two most important factors in well-being are having a sense of connectedness and a sense of purpose. And interestingly, when lockdown hit, for many people, those were the two things that were deprived. And so well-being really went downhill. And we often don't think about sense of purpose and connectedness. If all of our services, the first and foremost, were to think about who can I connect this person to, then we'd be onto a winner. When I was working in the homeless sector, I used to talk to some of the guys that moved into the hostel that I worked in, and they hated moving into hostels because on the streets you're very busy, and they had a real sense of purpose, and even if that's just to survive. So they'd come into a hostel and they would be sat there in their room and they'd have nothing to do. So it's things like that that we need to really take into consideration. Amy, if you can go back onto the slides. So when you're getting out there and asking people stuff, don't ask them what they want and what they need. Ask them what they value. You can also use questions, things like, if you had a magic wand, what would be the one thing that you'd change? If you had £1 million, what would you do? Think big, think questions that really get people thinking, but thinking in a positive way and not about, oh, well, that's not working and that's not working and that's not working. If you end up having conversations like that, try and reframe them to, okay, it's not working now, but how could that be different in the future? What do you wish had happened that would have made it a better experience? Next one. All of this stuff that I'm talking to you about is framed around something called appreciative inquiry. Next one, Amy. So appreciative inquiry was created by a man called David Cooper Ryder. And as I said before, it's a way of looking at the world. It's looking at the world through a lens which is that there is strength and there is positivity and there is stuff that we can do, rather than, oh, we've got all these problems and all these things that we need to fix. It flips it over to not problem solving, but building on what's already best and already working. And when you use that frame, it brings a certain amount of energy to it, because people are talking about things that they're passionate about. They're talking about things that are good. When we use this with people who work in the system, we often ask people to talk about a time when they really felt they helped someone achieve their outcomes. Really the time when they really felt useful, really felt like they had this good relationship with somebody and it made a difference. And when we talk to people after they've shared those stories, very often they'll say to us, I haven't talked about something like that for such a long time, because we don't have a space where we talk about our successes. We spend so much time talking about problems and people who are not doing what we want them to do. So it's just flipping it over and giving people a bit of joy. Next one, Amy. So appreciative inquiry, it's been around quite a long time. If you want to know more about it, there's plenty of stuff on the internet. But ultimately what it does is to build knowledge around what works rather than trying to fix what doesn't. You focus your energy on creating more of what's already going on rather than trying to fix the bits that aren't working. Next one, Amy. We use appreciative inquiry also within a co-design framework. So when you're looking at service redesign, it follows a pretty bog standard approach. However, there's one step within appreciative inquiry which is often left out. What we tend to do when we're designing services is we go out and we gather insight and we get all the sort of intelligence and we look at it and we analyse it ourselves. That's the first mistake we make. When you're gathering insight from people, don't take it back to your offices and try and make sense of it. Bring those people back in and say, right, what does this mean to us? How does this relate to your experience? Have we got this right? What can we do with this? So always try and sense make with people. Don't try and sense make on your own, because our own lens will have an effect on that. So you gather your insight, and then what we tend to do is we go very quickly into solutions. Right, that's the problem, let's solve it. So we jump straight into design. What appreciative inquiry does is to bring in an extra step, which is dreaming. What we tend to find about bringing in dreaming is it means that people have the ability to spend a bit of time thinking about what if we had no budget restrictions? What if we could do anything? What if we were the best at this? Now, that's not to suggest that this isn't based in reality. What it means is that you're given the opportunity to spend a bit of time thinking about what could this be? And then you design and limit it down. If you miss out the dreaming section, then you tend to build from a limited space. You tend to build from a space which is all about, yeah, but we tried that and it didn't work. We haven't got the money for that. Oh God, well, can we do that? Will we have permission to do that? So you're building from scarcity. When you have a bit of time to dream, you're building from abundance. And yes, of course, there's limits. And of course, there's budget issues. But it means that you start with what it could be and you design in. Hopefully that makes sense. Right, next one, Amy. The other way that we use appreciative inquiry is to create questions that we're going to go out and ask the world. I've already mentioned some of those questions that work best, those ones around, what you value, how you manage, who's helping you, who do you go to when you need support. But who owns those questions? Really, again, it's the people. And as far as possible, bring together some people that you're supporting and get them to help you create the questions that you then go out and ask, because they will have real insight into what actually we should be asking. This set of questions was created by a group of parents in the continuing care system. So in England, the continuing care system is a health system which supports children who have severe medical needs. And the continuing care support means that they can stay at home rather than be in a hospital ward. We worked with 4 parents within the continuing care system who helped us to create these questions for other parents. They're very appreciative. And the other thing that we did was to try them out. So how many times do you go out and try out your referral forms, try out your assessment forms? What does it feel like to be asked those questions? As I said, emotion is a really important part of this. So we tested these out over a couple of months. They went out and they tested them out with their friends. How does it feel to be asked these things? But I think the reason I'm showing you this is the first question that they wanted to ask is, can you tell us what you love about your child and what are the best things about them? They insisted on having that in there because they said within the medical system, we are never asked what is good about our child. We are only ever told what is wrong. We went out and we gathered other parents together and we asked that question of people, and many of the parents burst into tears because they'd never been asked that. And they felt such guilt and shame about having such an unwell child and the impact that that had on their lives, that to be given the opportunity to talk about what they actually loved about them was really massive for them. And it set the scene for then the rest of the questions. What you'll also notice, and you'll get these slides anyway, but what you'll also notice is that there's a really lovely flow to the questions. So they all sort of make sense as they go. And then that final question of considering what we've already talked about, what 3 changes would you suggest for the future? It just sort of rounds it off. So really think carefully, who should be owning those questions? Who should be helping you create them? And less is more as well. Don't try and overload things. Less is much more. And that takes me on to the next slide, Amy, which is all about stories. So ultimately, go away from the questions. Don't even use questions if you can, and get people telling you stories. Appreciative inquiry is all about storytelling. And what you'll see from this slide is how important that you've got all your data, you've got all your beans and all your numbers. That tells you half the story. Don't make any assumptions on those numbers and those beans. You need to gather the context, and that comes from stories. Community is made up of stories, and if you don't add that context in, then you'll be making decisions on things that is assumed. Next one, Amy. This is the reason why you need to use stories. So Ozzy Osbourne and King Charles III have the same data, but their 2 contexts are so completely different. So spend time asking people, using sort of headlines. So rather than using survey questions or an interview sort of questionnaire, you can start just by asking people, you know, in your experience, how have you felt this has happened and that happened? Let them sort of talk about stuff that they want to tell you. Otherwise, you are controlling their narrative. When we do community development, one of the best questions that I've heard used is, how long have you lived here? Oh, you know, 10, 15 years. That's quite a long time. You must have seen a lot of changes over that time. And then you pause and away they go. So sometimes less is more, and as much of the story you can get is important, because again, stories bring in emotion. And as we said, emotion really needs to come into play at this stage. Next one, Amy. So there's a few other things that we use. I'm not going to go into all of them. You'll have heard of Dragon's Den. Dragon's Den's always quite a winner. I don't know whether you'll have heard of the others. Open space, I think, is quite a good one. Open space is a method that we use when we hand over the agenda to people. So you can have your the sort of thing that you want to inquire about. You gather people into the room about that theme, and you tell them that you're going to do an open space. And what you want is for everybody to bring a burning issue with them that's related to that theme. You've got no idea what those burning issues are or what those burning questions are. You'll have your own, so don't forget you're part of this as well. This is about a combination of you and them. And they come with their burning issues, and you ask them to share those burning issues. And people will galvanise around whichever burning issue it is that they're interested in talking about. What you'll find is that there will be themes across the burning issues. That's fine. You gather those up as themes, and you have discussion groups around each of those burning issues. You're not in control of facilitating that conversation. The person who's brought the burning issue facilitates the conversation, and they're also, or a colleague of theirs is going to be responsible for making any notes. But it means that you are literally handing the agenda over to people and not being in charge of what you talk about. They are in charge of what they talk about. The other thing that's quite good at an open space, if you can, is this idea that quite often we'll gather people together, and then we gather all the information, and we think we have to do something with all of that, and that becomes a massive project management issue. And you know, there's loads of stuff you can't influence anyway. So what we tend to use is a voting system, particularly in an open space, where people are given 10 votes for if they think it's important, 5 votes for if they want to be involved, and 1 vote if they want to lead on it. You get people to vote, and what you'll see is that there will be some issues and some discussion points that are not considered to be important. You let those go. They are not important. So you have to have the confidence to go, nobody's galvanizing around that, so it's not important enough. And then you can see who wants to be involved in some of the stuff, but you can also see who wants to lead and facilitate some of the stuff as well. So you're handing the agenda over to people, and then you let them do it. So the open space is a good one. The other one that's a good one, which we use a lot, is customer journey mapping. I don't know whether you use customer journey mapping, and customer is the wrong word anyway, but it comes from the private sector, which is why it's called customer journey mapping. And it really is a way in which to understand how somebody feels going through the journey of your processes and your support. You should primarily bring in people who have used your services. So as much as possible, bring in people with lived experience. If you can't do that, then you can role play. And if nobody wants to role play, you can use a scenario, a case study. But you need to put yourself in their shoes. And following a customer journey map helps you to understand where the touch points are with your service, how they feel before that touch point, and how they feel afterwards. What we find is emotion has a massive part to play in how people engage, but our processes don't take that into consideration. So I'll give you an example. We were doing some work with an early help programme in the south of England. And fortunately, all the people in the room were parents, but they were commissioners. We didn't have people with lived experience in the room. And they took us through the journey of somebody being referred into early help. So the case study we used was a woman whose husband was in the army, so he was away 6 months of the year. She had 2 children. Her oldest was autistic, and she had postnatal depression after giving birth to her second. So she was really, really struggling, finding it very difficult to leave the house. very difficult to have the energy to do anything. She had Home Start volunteer who used to go in once or twice a week. And it was the Home Start volunteer that referred her to the early help service. So we said, okay, so what happens? So the early help service will get back in contact with her and they will send her a letter saying, hello, you know, we are the early help service and we're delighted to be able to support you, blah, 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 blah. And they said, and I said, so what's the address? What does the letter look like? And they said, well, it's on Children's Social Care letterhead. And it's like, okay, so if you were to receive a letter from Children's Social Care, how would that make you feel? What would you think? And they thought child protection. Right, okay, so you've got a letter that's sent to her that she potentially believes is from child protection. She's absolutely knackered anyway and struggling and anxious. How is that going to make her feel? Oh, even more anxious. Okay, great. What's your next thing that you do? Oh, we phone her. Right, so she's really struggling and she's anxious and a private number comes up on her mobile phone. How many of you would answer that? Oh, no, I wouldn't answer that. Right, how many times do you phone her? 3 times, okay, and what happens if she doesn't answer any of those calls? Well, we just believe she doesn't need the service. So it's that sort of thing that we need to take into consideration. And a customer journey map really helps us understand how emotion plays into what we're trying to do. Next one, Amy. So this is, I suppose, just sort of summary, and then we'll take questions. Things to consider, and it's just big. It's quite broad, but level out the power. If you want to get the most out of people, we need to come as people ourselves, and not as our job position and the tasks and the roles that we have behind us. We are also community members. We are also residents. We are also people in our own right. So try to let go of the job and come in as a person. The more you do that and the more you connect with people as a person, the more they will give you and the more they will work alongside you. Change your questions. So less about what people want, what they need, less about surveys, less about things that you have created yourselves. Get out there and create questions with people. What is it that's important to them that they want to learn about? Have a range of methods. So what we used to do when we were doing this is that we used to bring in people. We'd have a team of people that would be going out and chatting to their friends and their colleagues. But we also we'd go to playgrounds, we'd go outside shops, we'd go to waiting rooms of benefits agencies, anywhere that people are already gathered, and we'd sit and chat to them and try and get some of their story. And we'd always ask them, who else should we speak to? Because that then leads to all sorts of other inroads. Who makes sense of the results? Shouldn't be us. We need to bring people back into the room and invite them to talk to us about how this relates to their experience. Have we got this right? What does this mean to us? What should we do with it? And finally, be creative and have fun. One of the things that is really different to our work life compared to our home life is that home life is generally more fun. I remember meeting a social worker once who said to me, the thing is, if I have fun at work, then I'm not considered to be working. So have some fun, because that again levels out the playing field, and it brings much more when you have fun and you're being creative. So take some risks, get out of the offices and go and have some fun. I'll shut up now.
Just to add on the having fun thing, one of the things which always strikes me when we talk about this and when we put some of these approaches into practice is use them in your teams, because it's so interesting to see how groups of professionals respond. I know Helen and I have used things like Lego as part of co-designs with people who are working in services. And to start with, you see people sitting there really unsure and not sure whether it's okay. Like, is it okay to be playful? But actually, once people get into it, it switches off a certain part of their brain and allows them to engage in a different way. So these are tools which are absolutely brilliant to use with communities, but they're also fantastic to use when you're looking to gather insights from within services and from within people who are kind of working in those roles in communities as well.
Amy and Helen, do you want me to are you ready to move into the questions? And yeah, thank you both so much. I just wanted to say, that was an absolutely fantastic oversight of so many of the key points, the key considerations when thinking about doing service design engagement work with communities. Really kind of, it's inspired me, it's reinvigorated me, to be honest, and I feel like I could go back and watch that again and kind of continue to kind of take more detailed notes. And I'm sure, I hope that others that are on the call will have questions or even just reflections, what resonates or what you might find challenging about taking this approach. You know, something that I was thinking about just when you were talking there at the end, Amy, and about colleagues is that it can actually, this can feel quite unsafe and vulnerable work for people who we work with, senior leaders or colleagues as well. So that's an interesting sort of perspective, and something that I think we've definitely reflected on the work we were doing in Fife. I have a question, which actually is really interesting for me. So I love the appreciative inquiry approach, and I've used it in different contexts. But when we talk about a service design, and if you look at the human learning systems bit as well, I think that there is something about, they talk about spending time understanding the problem that you're trying to solve. And I'm wondering if there is a way of doing that which leans into the appreciative inquiry kind of angle, rather than kind of gets people stuck in the what's wrong, but still allows us to take time to really understand what's going on. So yeah, just wondering if you had any reflections on that.
Yeah, go ahead. And then I've got an example to share of where people do that.
Yeah, so it's interesting that we frame it as understanding the problem, when actually what are we trying to achieve? So you flip it over to, okay, this is the problem. What is the opposite to that? What is it that we're actually trying to get to? What is where and really you can spend time really thinking, what would it be if it was best? What would that be? So that you've got this sort of overarching vision of where it is that you want to go. So it's literally just taking the problem and flipping it over and saying, okay, if we fixed that problem, what is it that we would achieve?
Yeah, and there's a wonderful example from a commissioner in Liverpool who works in a very human learning systems way. And what that commissioner does is they go out and they spend time in their services, listening and talking to people. So exactly like Helen's describing there, they are understanding the challenges, but they're doing it from a, what is this like day to day? What does it feel like to be in this place? What does this service kind of feel like for people who are coming in? So it's really understanding the system rather than framing it as understanding the problem. So it's a slight shift in language in terms of how you understand it through a human learning systems lens. Similar work happens in Plymouth, where they've taken a whole system approach to complex needs in the city, and they do exactly the same. So they go out and they listen and they spend time in communities to really understand the system, so they can understand what's working really well and where there are gaps and opportunities that they might need to work together and collaborate around.
That's brilliant. Thank you so much. I think that's a really helpful way of thinking about it. And it just reminded me of some work that was happening in Fife around mental health crisis services, and the difference between when the professionals said, well, this is how the system works, and they presented this beautiful flowchart of how people access crisis services in mental health. And then it was a co-produced conversation, and just the laughter, actually, to be honest, from the people that had experience of using crisis services, and how completely there was this mismatch between the beautiful theory of the system and then the reality of what the system looked like on the ground. And yeah, and that, I mean, we didn't get anywhere with that, to be honest. It's still, but I think it's
there's another example, Pegs, in Lambeth, when they first looked at their mental health system, probably around 15 years ago now. And the issue was that there were too many people in inpatient units, and they were very expensive. And it's like, well, you know, we need to do something about this. That was the problem. The commissioner and the people that he worked with turned that into, we want people to stay well. So the focus of all the work they did was about how can we keep people well. It wasn't how can we get people out of the inpatient units. So it's literally reframing it. Language is really, really important in any of this. And we need to be very careful of our language.
Yeah, I hope that's super helpful. I'm noticing I was going to try and repost the Menti thing, but I'm just because I could witter on very happily with Helen and Amy for a long time about a lot of this, but I'm wondering if anybody's got any questions they'd like to pop in the chat or put their hand up. You know, there is no such thing as a daft lassie question or laddie question, no such thing as a right or wrong reflection. That is kind of the point of this, actually. So yeah, just hold that space for people. You can also just show a real hand if you've got your camera on. Be brave, folks.
It's also fine if there's no questions.
That's true. That means we've answered it all.
Yeah.
Somebody's mentioned in the chat, and I think this is, you know, I'm blown away by the presentation, but lots of change needs to happen. And I wonder whether, and especially actually coming back to one of the things you said about the importance of sense of purpose, because a lot of people on this call are involved in employability. That's the sector that I specialize in, and many of the people on the call specialize in. And, you know, for me, a lot of my sense of purpose comes from my work. And our role in supporting people to get work. If you ask people about what matters to them when it comes to getting a job, a lot of that can be around sense of purpose, like having a sense of purpose, feeling like we have something to contribute and in this world, rather than always being seen as a problem. I've definitely heard that said. And so I wonder also what that might mean for us too, as providers, thinking about actually if we reframe what we're doing around supporting people to find a sense of purpose, does that also subtly shift what we do and how we do it?
We are doing, sorry, Peg, so we're doing work around employability in England at the moment. And one of the things which is coming up is exactly that comment, lots of change needs to happen. And very often that can feel overwhelming and can feel like a barrier to people. But what we'd always encourage people to think of is just think of something small where you can start. So start somewhere. Don't let the need for kind of huge systemic change get in the way. But is there something you could just try something out on? Could you change the questions you're asking people at first contact and see what happens? And then how might that open up other opportunities? Completely understand how overwhelming it can feel. When I worked as a commissioner and in delivering services, sometimes that can feel insurmountable. Sometimes it can feel like we haven't got the budgets or the, you know, all of those things, but just trying to find that little place where you can try something out, even if it's just asking a different question to see what that opens up in terms of possibilities, can be a really great place to start.
Oh, thank you, Amy. That's so inspiring. Yeah, Helen, go on. You were going to come in.
The other thing I wanted to say is that you're not the only ones trying to do this. So there's a massive movement across the country. When I left Lambeth Council, it was still in its early stages, and that was sort of 2015. Now, you know, with more budget cuts and more people lifting their heads above the parapet saying we cannot keep doing this because it's not working, more and more people are getting involved in co-production, in collaboration, in trying to really think things through differently. So there is a momentum to do it. There's a lot of things stopping it from happening, mainly processes, mainly the decisions that are made above you, the way things are funded, the way things are measured in particular. You know, it's interesting, Pegs, that you're talking about sort of looking at employability as having a sense of purpose. In fact, probably what you're being measured on is how many people are getting into work, which therefore means that you're spending your time getting people into work when they're not ready to get into work, but you need to prove that you've got people into work, and then they don't manage, and so they come out of work again, but at least everything's ticking the box. So it's a bit like the housing association I'm working with at the moment. They've got 80,000 boilers that they need to get into people's flats. So these are electric boilers that they have been given. It's free. And what they're being measured on is how many boilers are getting put into people's flats. However, people don't want the boilers because it's going to increase their electricity bills, and they don't like the housing association. So therefore they're not interested in having the boilers. So if you were to turn that into measuring how you're improving somebody's well-being, then it brings a completely different focus on it, and you're not counting the beans, you're counting the quality of life that boiler provides.
Yeah, it's an absolute challenge. Carolyn, I see your hand up there, but just to say, like, the challenge of the numbers game is one that resonates hugely in our sector. It's such a performance managed numbers in, I could talk about numbers in, numbers out game, and even sometimes funding is, you know, attached to whether you've achieved those numbers in, numbers out, which kind of ignores the complexity and can ignore sort of the ability to flex a little bit more to what matters to people. But Carolyn, over to you.
Hello, hi. Sorry, I had my camera off because I need to wash my hair. How shallow is that? I just think you've all been brilliant. This has really inspired me. I'm feeling so fired up. I've worked in housing and social housing and in the charity sector a long time, and these are barriers that I've faced because people above me or commissioners and people have always, but here's the legislation, here's what we must, follow. And I've always been a wee bit the person that wants to change that a little bit, but sometimes the weight above me was just too much. So I just had to give in. But I've got a piece of work to do just now. I'm working with a charity and I've got a little bit of work to do to interview customers, clients, whatever, who have been on a journey of homelessness and have been housed and how it feels for them. So I'm definitely going to test this. I'm going to take a different approach and see what happens.
It's brilliant. Good luck. Good luck. And I suppose there was a question in the chat also about bringing in statutory partners, and there's something about following on from Amy's idea of starting small is also to find your allies. So find out who is it in the system that actually really gets this and really wants to help. There's no point in trying to persuade people who don't get it, and my God, there's a lot of people who don't get it. It will just demoralise you. So it's about finding your allies, finding about people who want to do this with you. And then, the other thing that you can do if you really want to is you can do what's called power mapping, which is, okay, you've got a statutory partner who you really need on board, but you might be the wrong person to influence that person. You might be you might be not high enough in the hierarchy. They might not like you. They might be it may be that you're the wrong person to influence them. So then it's about working out, who do you know that they then know that can influence that person? So think about that as well, in that way. But yeah, so start small, and find your allies. Don't try and do this on your own. And also, it's much more fun when you're doing it with somebody else.
That's a brilliant lead in to a couple of things that I wanted to share with people as well, actually, Helen. So for those of you, some of you may know, but probably many of you don't, because of the work that we've done in service design in Fife and because of the continued interest around service design in Scotland for No One Left Behind, I'm working with some colleagues to set up a community of practice, and that's for people who are doing this kind of stuff. And the idea is it's going to be a space for us to come together, share our struggles, learning, all of that. Very much a kind of sharing the muddling through bit and the mutual support bit. But in addition to that, what has become clear is that there is also a real desire for learning more about what this weird thing is, how to do it, and what is required to do that well. That's evidenced by everybody coming along here today, and it's evidenced by interest in other sessions that we've run. So I'm going to be talking to colleagues about putting on some introductory sessions, but also what might be useful in terms of a more longer term, if there's appetite, a more longer term sort of skills growth, development thing. So we'll see if we can make that happen. But I really think the more that we can come together, the more we can connect, the more that we can support each other, the better. And I suppose, just to reiterate Amy's point about the starting small thing as well, like it is immensely powerful to, if you're faced with no, we're not getting much buy-in on this, then just starting with a small project and demonstrating the power of impact that this can have. It can be as small as looking at changing some of your paperwork. It does not have to be a radical service redesign. But once you've kind of built that evidence, built that journey, built the sense of this is something which can have an impact, it really can begin to snowball. and or at least that was my experience. So, you know, I do think, yeah, I love that. Start where you are and do what you can was a motto somebody once shared with me, and I yeah, it stays with me. You know, find the windows, find the chinks.
There's something I wanted to just to add to that, Pegs, which is also about start interrogating why you're doing things. Start asking questions. Why do we do it this way? And I know that you're counted on, you know, the way that your performance managed is very numbers based. Why? Start pushing back. Don't just accept it for the, well, this is the way it's got to be, because it doesn't have to be like that. And if you remember in COVID times, things changed just like that. Policies, procedures, all changed. All this stuff can change. So just start agitating.
Thank you very much. Are there any last questions or comments? Amy, did you want to come in with a few kind of final words or thoughts?
I was just going to add to Helen's point. I think counting the numbers is still important. It's still something you're going to have to do. It does matter, but there is something really powerful about bringing those two things together. So using what you said, Pegs, where can we start to tell a different story, and where can we put that alongside the way we're performance managed? Because that's a way in. As someone who used to be a commissioner and used to ask for those numbers, when my services would also kind of start to show me the stories and bring that to life in a different way, and open up that conversation about, so what's this telling us? And being curious about what are those stories telling us, what might we need to do differently. It can be a really powerful way in. So not kind of completely disregarding the way we have to kind of report. That stuff does matter. That tells us an important part of the story, but what else can we add to it, and how can we kind of bring that to life in a different way, which really puts people at the heart of what you're doing, and at the heart of kind of what matters to them as well.
Brilliant. Thank you so much. I think that's a really probably incredibly valuable place to end. We will send out a wee evaluation, Jane, hopefully when she gets a moment. She's got a busy week this week, and we'll send out the recording and the slides, and really, all that remains really is for me to say a massive thank you to both Helen and Amy for sharing your learning, your knowledge, your experience. Really inspirational. You can see it in the chat. It's hopefully lit a few fires around the room, which is absolutely brilliant. And also just to everybody else for chipping in, for showing up, for caring, and for wanting to continue and be part of this kind of, yeah, hopefully a bit of a collective journey, a collective movement for how we think about and learn together to do things differently. So really appreciate that. And peeps, if you want to unmute before you say bye, then feel free to do that. It's always quite cheering.
Thanks, everyone. Good luck.
Thank you.
Thank you.